How do family deductibles work compared to individual deductibles? Have you ever wondered how family deductibles differ from individual deductibles in health insurance? Understanding these terms can help you make informed decisions about your healthcare costs. Let's break it down. In health insurance, a deductible is the amount you pay out of pocket for medical services before your insurance starts to help. There are two main types of deductibles: individual deductibles and family deductibles. Individual deductibles apply to each person covered under the plan. This means that every family member has their own amount they need to pay before their insurance kicks in. For example, if the individual deductible is $3,300, each family member must cover their own medical expenses up to that amount before insurance contributes. On the other hand, a family deductible is the total amount that all family members must pay together before the insurance starts to cover costs for anyone in the family. This amount is usually higher than an individual deductible. For instance, a family deductible might be $8,550 or even $17,100, depending on the plan. Once the combined expenses of all family members reach this family deductible, insurance coverage begins for everyone, even if some individuals have not yet met their individual deductible. Now, how do these deductibles work together? Each family member's expenses count toward both their individual and family deductibles. If one family member has high medical costs and meets their individual deductible, their insurance starts covering their expenses even if the family deductible is not yet met. If the total expenses of all family members reach the family deductible, insurance coverage begins for all, regardless of whether each individual has met their own deductible. To illustrate, imagine a family plan with an individual deductible of $3,300 and a family deductible of $8,550. If one family member incurs $3,300 in medical expenses, their individual deductible is met, and insurance will cover costs beyond that. If the combined expenses of all family members reach $8,550, the family deductible is met, and insurance applies to all members, even if some have not reached their individual deductible. It's also important to note that some plans cover certain preventive services without requiring you to meet any deductible first. Deductibles apply only to covered services and do not include premiums or non-covered expenses. After meeting deductibles, you may still have co-payments or co-insurance until you reach your out-of-pocket maximum. Understanding the difference between individual and family deductibles helps families anticipate their healthcare costs and manage expenses effectively. It also influences decisions about which insurance plan to choose, especially if multiple family members are likely to need medical care during the year.